One of the things that I hear missing from this very riveting conversation, and thank you to each of you for what you said, is the reality that this particular substance is comprised of fentanyl users who I worked with in 2023 New Mexico. I'm going to ask a question. People who are deliberately using fentanyl, that's their drug of choice. A second population is people who struggle with substance use disorder. And so it could be Xanax, it could be Percocet, it could be an array of drugs, and happen to, in that, take too much fentanyl, oftentimes unknowingly. But then there's a third category that we're not talking about today. And that's the category of people, we don't know what the percentage of the annual deaths are. And I have a letter here from a mom who ends it, and I'll ask a question right now. She says he wasn't a drug addict. He had no prior substance abuse. Just a silly kid who made a bad choice because he based his action on what he believed he was taking, a Percocet. What do we do about the population that's dying who are not struggling with addiction? Thank you.
Oh, please.
Can I say something about that? One of the things that I think that I've done a lot of reporting about this issue, and I think that one of the things that's really important to grapple with is that the death of children in this way and young people in this way is a catastrophic event for families. And it's something that we need to do everything that we can to educate and to work on breaking down social media channels where people are accessing drugs like this. But I do think one thing that's really important for us to be clear-eyed about is that it is a very, very, very small percentage of the overall event. When you look at the number of people, and again, it's for each individual family where it occurs, it's catastrophic. But I think that one of the things that, again, when you look at data and when you look at a public health response, it's really important to be clear-eyed that those issues draw a ton of attention. They get a lot of press coverage, and I understand why. I'm a journalist. When you have an event like that, it's very significant. But the actual numbers are very, very small.